Good afternoon, ladies and gentlemen. I'm Dr. Emmanuel Rilka, the Executive Director of the African Palliative Care Association. I take this opportunity to welcome you to this webinar, which will take us exactly 1 hour. And I would like to take this opportunity to welcome Rachel and Damot, who are going to lead on this. Rachel has been working in the international development sector for over 25 years, specializing in resource mobilization. And since 2012, she has been the director of Flamingo for NGOs, offering consultant services in funding and management to international NGOs as well. Rachel has particular expertise in fundraising, strategy development and implementation, donor intelligence and research, training and mentoring, and experience as a senior manager and fundraising practitioner. Rachel has an MSc in development management and an MA in gender and international development. She's a strong believer in collaboration within the international NGO sector, and she's active in the UK's bond network of UK NGOs. Rachel will be handling this topic together with Damot. Damot is based in the Netherlands. He's a consultant and he has been active in the field for over 20 years. I had the experience and the opportunity of working with him at Mildmay International between 2003 and 2011. And he has been within the international development arena. He's been focused on institutional donor funding acquisition for international NGOs. He has led institutional funding teams at a range of NGOs, as I've mentioned, including Mildmay International, VSO, Trocare, and BRAC. As a consultant since 2015, Damot has undertaken assignments for NGOs, networks, and trusts, mostly linked to health access and rights, with a focus on supporting funding, strategy and program development. And he also has experience working with major global health institutional and foundational donors. This has included supporting clients to pre-position ahead of grants and contract calls, leading and contributing to large complex core issues by DFID, EU, Dutch government, and USAID, with a successful track record in securing transformative grant funding. Damot currently supports a number of global, regional, and national health alliances, and this has been mainly in the area of HIV, but also universal health coverage, key population health access, and rights and palliative care. Ladies and gentlemen, that's the team that's handling our topic today, and please allow me to hand over to both Rachel and Damot to take us for the next 1 hour through this process as we all look at the issues around funding and how the donors, the donor terrain is changing as we face the COVID-19 challenge. So Rachel and Damot, you are very welcome.
Thank you.
Thank you, Emmanuel. So I'm going to start and I just want to say thank you for giving us your time this afternoon to go through some of the issues around funding and positioning in the era of COVID-19, especially for palliative care NGOs in Africa. And I was thinking back to the beginning of this year when I first had a conversation with Emmanuel about developing a short webinar for palliative care NGOs and members. And from that conversation to today, which is not that long, the world has completely changed. And this webinar hopefully will give you a snapshot of some of the evolving trends influencing donor funding responses to COVID-19. And what we're seeing after this initial panic and disbelief really, and shell-shocked donors and NGOs, we're now seeing a surge in donor emergency funding coming through from a range of donors in a range of modalities. And this is creating some short-term opportunity for NGOs. And the sheer scale and rapidity of what's going on is very daunting, even for professionals like myself and Rachel working in this field. You know, where do you start? Who's getting what and how? And how do you pivot to best access this funding? So we'll try and unpick some of these issues and questions and provide you with some level of context and signposting in this webinar. So if we can move on to the first slide. So we're going to be looking at some of the health, political and economic trends related to global health, NGOs and the COVID-19 situation. Looking at the various funding streams coming through and also what the donor responses are. And also to give you some practical guidance and steps to building income in the current situation. So I think, next slide.
So shall I launch the poll?
Yes, we need to answer the question, ask the question first, which I think is on the next slide. Yes, so we want to kick off with a quick poll, just to give you a flavour of what's really happening out there. So in terms of donor funding and where it's going. So DFID has given $900 million to UN COVID-19 responses. And the question to you is, how much do you think has been channeled through local NGOs, so grassroots NGOs working at a national or local level in, say, in sub-Saharan Africa, for example? So you've got a poll function on your on the bottom of your screen, and the poll is coming up now. It's just been launched, and you can. It's like a multiple choice. Just choose your answer, and we can have a look at what the results are. Okay. How long do we give for the poll, Rachel?
Should we just give a little bit longer for people to find it and respond?
Okay, some good results coming through there.
Okay, so I'm going to end the poll now.
Okay,
and share the results.
And the results are through. So we've got well, half the respondents suggesting that it's around 15% of funding reaching grassroots NGOs, and then 3.6% is the second result at 28%. So the answer actually is 1.4%, and this figure came through from a result at the UK Parliament International Development Committee meeting last week, where the politicians who have been questioned about where the funding was going, and the parliamentary watchdog was given the answer that 13 million of the 900 million committed to the UN by DFID had gone to local NGOs. And this is reflective of what we're seeing, a huge bulge in new funding coming through and very little trickling down to grassroots level. Okay, so we'll move on to the next slide. And just to give you a quick snapshot of really where the pandemic is at the moment. And it's entering a new phase with the numbers in Europe and the worst affected countries now declining. And this chart, I like this chart because it's a really good visualization of the waves and the trends geographically. So we're seeing here, for example, in the Netherlands, the lockdown massively easing actually, and the pandemic seemed to be very much under control. We haven't seen the feared increases in Africa, and as you can see, Africa hardly makes the visualization at the bottom of the chart here. What we are seeing is the pandemic, the eye of the storm, as it were, now over Latin America, Russia and India, and seeing massive increases in the in the infection rate and the rates of mortality in those regions. In terms of global health, on the next slide, there are concerns over a second wave, and the focus is very much now on developing vaccines, diagnostics, and drugs to treat COVID-19. Just in Africa, from the African context, I give some statistics there. That was a few days ago. I think it's the CDC estimates now it's over 160,000 infected in Africa. And people are obviously, even the experts are not aware or unsure of where the pandemic trajectory is going in places like Africa. Maybe the demographics or environmental or the lack of comorbidities is helping there. But what we are seeing is the disproportionate impact of COVID-19 on health workers and the most vulnerable, and it's exacerbating existing inequalities at all levels in society. And that's in sub-Saharan Africa, but also here in Europe and in North America. We're seeing huge disruptions to treatments and prevention of other socially significant diseases. And the threat to health systems is still there for both the global north and south, and especially for stressed and fragile health systems that exist in a lot of countries in sub-Saharan Africa. Aid groups fear resource steal as a result of illnesses like HIV and TB and malaria are going to be neglected, as the funding focus is very much now on COVID-19 and addressing the issues around that, which is storing up huge problems for the future, for the immediate future in terms of global health. WHO Chief Tedros last week said that the pandemic could curb recent progress in low-income countries on life expectancy and access to services for HIV, malaria, and tuberculosis. And linking that to the broader health development landscape and palliative care, we are already off track for 2030 in achieving UHC, and the funding gap for UHC remains vast. And development assistance, as this chart here, as you can see, development assistance is still very much focused on health systems strengthening, sector-wide approaches. But out-of-pocket expenditure remains high, and some of these statistics coming from the Global Fund, analysing the current global health situation as it sort of revises its global strategy, suggests out-of-pocket expenditure will remain high between now and 2030, and that domestic resource mobilisation will need to step up to achieve the goals for 2030, especially as international donors pull back. So it's a pretty dire situation, really, for global health funding going forward. Could just maybe have the next slide. In terms of the political and economic trends, we're seeing a complete lack of leadership from the US in coordinating the international response to COVID-19. And we have to be realistic. There's no easy substitute for US leadership and funding and strategic policy and logistics power for addressing this pandemic. And I mean, a case in point is that the 7.4 billion that was raised at a pledging conference last month that was hosted by the EU had all China and all the major global economies and donors were there virtually, and the US wasn't present. So it just shows you of the vacuum at the moment in global development and global health when it comes to the US, and that's not going to change in the short term. In terms of the economy, the economic output is being slashed in the US and in North America, in Europe, and the Far East. We're seeing huge drops in European GDP, for example, of maybe 30% in this quarter. And it's wiping out $8.5 trillion from global output there in the next couple of years. A lot of the poverty is going to be extreme poverty is going to impact the poorest countries most, and OECD statistics suggest 56% of the rise in poverty will actually occur in African countries. More people will be in extreme poverty. We're also seeing a big debate on how quickly the world will emerge from this crisis in terms of the economic recovery, whether it's a V shape, which is a rapid recovery, or a U shape, which is going to take much longer, or even an L shape where there's no recovery. So we're seeing lots of debate about where that's going forward. What we are seeing is an increase in digitalization and automation in all sectors, including the development and NGO sector. And they are probably trends that are going to remain with us. We're also seeing big concerns over food insecurity going forward. And in terms of unemployment and the informal economy, and that's where a lot of the workers in LMIC countries work. We're seeing that nearly 1.6 billion workers in the informal economy are in immediate danger of losing or having their livelihoods affected or even destroyed. So some big challenges going forward. And in this context, you've got, move on to the next slide, the ODA budget. So these are like the international development budgets that national governments develop and use as international aid to the global south. And we haven't seen any big cuts so far, but what we are seeing is that countries are stepping up in terms of their coronavirus responses, in terms of the domestic response. So up to 10% of UK or European GDP has been spent on domestic support measures, and that's a huge amount of money and creating a huge amount of debt. Governments will have to step up and revise their budgetary priorities, and we're seeing that already sort of being penciled in for later this year here in the Netherlands, for example, and also in the UK. And what that means is, will the aid budget for the big donors be an easy target? I believe that that's going to be the case. There's a big risk of big cuts coming forward. The ODA volumes at the moment are sort of being maintained, but a lot of the development aid budgets are linked to economic growth. And if we're seeing big cuts in growth, then we're going to see big cuts in ODA budgets going forward. So it's a very difficult time for the sector. And while the development sector is a powerful asset, I think in the toolbox to combat global health insecurity, I don't think we're going to see a PEPFAR or global fund type of approach because of the the weak international institutions out there at the moment. And I think we're going to see a lot of countries and even the global north and global south competing against each other for scarce resources and for PPE and even for the vaccine when it comes about. So we could see the pandemic exacerbating global inequalities. And I think the likely and unfortunate conclusion is that ODA and as a result, NGO income will probably flatline and decline in the next 2 years. And this will be a sector-wide problem, not just for global health NGOs, but it'll be an environment where all INGOs and local NGOs will be operating. Given the fact that global development has been structurally underfunded anyway for 10 to 15 years, it means that it's really going to put vulnerable and weak health systems at greater risk. Okay, so with that, so that's kind of depressing news, but we do have some better news for you in the next session with Rachel, who will give you an overview really of what the short-term response has been, and this is where there is some opportunity for NGOs. So handing over to you, Rachel.
Great, thanks a lot, Dermot. So the next few slides are going to look at the donor response to the COVID-19 crisis, starting with looking at what the immediate response has been and then working through to longer term perspectives. So in the immediate term, many donors have shown a willingness to be flexible and to flex or pivot on grants. And both in the UK and the US, there's hundreds of foundations that have signed up to commitments to support their grantees, for example, by unrestricting grants or by agreeing for flexibility in reporting timetables. And you may have had experience of that yourselves. This commitment's also been signalled by many institutional donors, the difference being that for the institutional donors, quite often the processes are much more slow and bureaucratic. So while there is a commitment there to be flexible, that's taking a while to come through in actual changes to contracts. We've also seen a large number of immediate response granting opportunities, and often with very short deadlines, and also new partnerships. So one example is DFID's partnership with Unilever to roll out a specific WASH program in a very short time frame. And in some cases, there's been opportunities for new grantees to come in, but more often or not, the opportunities are focused in the short term on current grantees. And there's a lot of examples of this, for example, the IKEA Foundation, Gilead, DFID's UK Aid Direct programme, to name a few. And DFID, DevEx tells us that there's been a total of around 201 not-for-profit grant opportunities made between January the 1st and May the 2nd this year, with a financial assistance of $590 million across strengthening health laboratories, virus research, and civil society protection. So there's a lot of opportunities that have come up, but as I say, they've been with very short time frame. And this is all within the context of the fact that, as Dermot mentioned at the beginning, many frontline NGOs are very worried about how much of the money that is being committed overall is reaching the front line. And as we saw from the poll at the beginning, this is just, you know, it can be tiny at just 1% in the case of the funds committed by DFID. So what is the likely impact on planned funding programs? So these are funding programs that were already in process. Well, many of these are going ahead as planned. For another example is DFID's UK Aid Direct schemes that have been launched with a deadline of the end of this month. There's also been several EC calls for proposal, and some of these have been focused around COVID-19, so setting their planned focus within the perspective and in the light of COVID-19. And the Dutch are also continuing with their 1.2 billion civil society strengthening procurement process as planned. For some of these opportunities, there's a new COVID-19 perspective to an existing programme, and quite often applicants will need to show how they are integrating COVID-19 into their planning, including looking at how they build it into risk assessment, what new activities they might need to reach the most vulnerable, and what the impact of COVID-19 is going to be on the planned programmes. We have seen a smaller minority of donors who have suspended their giving programmes, that this isn't really the norm. These smaller donors have actually refocused their giving to national or domestic needs. But as I say, it is a minority, and they do tend to be smaller donors. Intelligence also suggests that we should be seeing more country-level opportunities coming through. We've already seen the launch of the Canada Fund for local initiatives in various countries, and we're advising country officers to keep in touch with their local embassies and missions and keep an ear to the ground for any possible future and short deadline calls. So just to go through some of the bilateral donors, as we've seen, the response from many bilaterals has been to increase funding commitments to multilateral initiatives across the board. Unfortunately, we don't expect to see an increase in funding for civil society. With the UK, as we mentioned before, supply partners have been promised flexibility, and the reality is that it is very bureaucratic and slow. We had a communication from DFID this week that new decisions are on hold, which could be connected to the forthcoming reviews later this year, where we may be seeing DFID being merged into the Foreign and Commonwealth Office. The kind of impact of that will probably be that DFID's priorities will be much more influenced by foreign policy priorities. With the Dutch, as I mentioned, they're continuing with their civil society strengthening procurement processes. There's been a move to link increased foreign aid spending to the domestic economic support package. So there is some kind of move there to look at how foreign aid spending connects to a domestic COVID response. But this is unlikely to pass into law. And extra funding has been provided to several of the multilaterals. With Germany, there's a proposed €3 billion as part of Germany's 150 billion domestic corona support package, similarly to the Dutch. And current projects are being refocused. The BMZ's Marshall Plan for Africa is to go ahead as planned, with that having the focus on youth entrepreneurship, agriculture, anti-corruption, private investment support, and investment climate improvement. For the USAID, we're seeing that funds are going to be repurposed, and I think this is true across the board with a lot of the bilateral donors. So funds would be repurposed rather than drawing down on new funds. And we've seen individual countries targeted with new calls. So for example, Ethiopia, Bangladesh, and Ecuador, and this is a trend to watch. USAID are also apparently accepting unsolicited proposals relating to COVID-19. However, at this stage, we don't have any guidance as to how those proposals should be shaped. So again, it's something there to watch with USAID. So I'm going to move on and look at the multilateral response. As I mentioned earlier, with the European Union, they've recently released a number of calls, and more recently, a lot of these have been focused on East and West Europe. So some of these calls have got specific COVID-19 focus. And the EU are actually currently in the position that they're at the end of the current 5-year planning cycle process. And going into the new process, there was also already some concerns about the future of EU aid support to NGOs and to development. And much of the COVID-19 response has been taken from existing budgets and following EU strategic priorities. So Whereas we are seeing some calls at the moment, in the longer term, we don't know exactly what that's going to look like. In terms of the Global Fund, they've approved a COVID-19 response mechanism, authorising $500 million of funding, which comes in addition to $500 million in grant flexibilities to Global Fund countries. And then with the development banks, we have $3 billion of COVID-19 social bond from the African Development Bank. And the African Development Bank has also announced £10 billion to support the promotion of structural transformation and green growth, taking into account COVID-19 perspectives. The World Bank have a $14 billion COVID-19 response plan and have also announced an additional $160 billion package of financial support to help 100 low and middle income countries respond to COVID-19 impacts over the next few months. And with the UN, we've got the Response and Recovery Fund, which is an interagency funding mechanism. We've also seen this week the UN announce a grant focused on digital remittance solutions, and UNICEF have introduced a $3 million FAST fund, which underwrites PPE procurement delays. So overall, contracts and procurement have seen big increases. However, apart from the EU, opportunities for civil society and for NGOs, for multilaterals, are mainly in terms of being able to facilitate supply chains and in terms of procurement. So there isn't much there for civil society, unfortunately. So I'm just going to move on to look at philanthropic and foundation responses. Some of these donors have been very hard hit by the COVID-19 crisis and the accompanying financial crisis. So, for example, the Hewlett Foundation have put their programs on hold, and the Zurich Community Trust are only funding domestic focused projects. Other foundations are actually moving in to address some of the issues that are being exacerbated by COVID-19, such as the closing space for civil society, the rise of populism, migration issues, and the climate crisis. And many others are growing increasingly active in the funding of both research and response. So we see this, for example, with Gates and the MasterCard Foundation and the Wellcome Trust. As you can see there are various funds that have been introduced. And the Stavros Nikas Foundation has committed $100 million on research for treatments, testing and prevention, including an emergency award of $3 million to the Rockefeller University in New York to accelerate COVID-19 drug and vaccine research. So we just thought it would be useful to hear from you the response that you've noticed from your donors. So if you could just take a minute and share maybe your responses in the chat box, it would be good to hear from you what your experiences have been. So if you can find the chat box, and please do just post in anything that you'd like to share in terms of your own experience of donors in COVID-19.
So, for example, if you've seen some flexibility in current grant mechanisms that you've got with a donor, or any new funding even, or any core support that's been offered, or on the negative side, if you've seen a reduction in income, and any intelligence from you would be useful.
Okay, there's some nice examples coming in of donors being very sympathetic and flexible on addressing COVID-19,
Yeah.
flexibility in the use of funds and reporting from Patricia,
Yeah.
and with the focus on current grantees. Lacey has said that there's one foundation that has allowed us to redirect funding to COVID activities as necessary. And Nicola's also echoed that with existing projects, there's been flexibility with extending deadlines. And we're also hearing this from Joan, who said some national donors have been flexible, allowing us to use COVID-19 funds for COVID-19 and running costs. This is, yeah, so that's really good to hear that that flexibility is coming through. So from Wednesday, they've provided small grants with quicker approval for COVID-19 communications. I think, yeah, this reflects some really, really good donor practice. And I think that if we to take some positives from the current situation, I would say that best practice has really shone through in the way that many donors have responded to this by cutting out long and bureaucratic processes, by responding quickly, by being willing to be flexible and having the trust in their grantees to unrestrict grants. So that's been really, really good. And Jones also added local donor funding from individual and companies has dropped significantly, which is the downside. And Nicola has said some projects are asking for less paperwork and shorter proposals and demonstrating trust, which I think is, as I say, it's a really good upside, and I hope something that will be will direct donor policy in the future. You know, it's an experience that will help to cement good practice. So shall we move on, Dermot?
Yes. Let's move on to the last bit.
Okay. So what do we expect to see in terms of longer term changes in funding priorities as a result of COVID-19? So we are likely to see much more focus on biosecurity and global health. And there is also a strong move to have more focus as well on WASH, water and sanitation and hygiene. There's also the focus on universal healthcare and economic development. Other issues that have really come to the fore and I think have been exacerbated by COVID-19 have been issues around violence against women and girls. And I would say that probably this crisis has made, I mean, while unfortunately it has severely increased incidences of violence against women and girls, it's also allowed this area to become more highly profiled. And also there may be an increased emphasis in the future from some donors on human rights approaches and the closing space for civil society. As again, we're seeing COVID-19 as actually restricting some human rights and speeding up some of the closing space processes that are taking place. So in terms of longer term changes. It's definitely something that we should be aware of, and also looking at the intersection between issues such as the climate crisis and economic development and COVID-19. Here is a list of where to find out about more about current funding opportunities. This is also included in the briefing that we put together. While we haven't been able to go through different opportunities in detail, and in fact things are moving so fast at the moment that it becomes quite difficult to kind of pull together a database of those opportunities, because they tend to kind of be moving through quite quickly. We thought it'd be useful to leave you with this list so that you're able to do your own research. So that I won't go through these in detail, but there's a number of different sources and resources there with the links. So I hope that that will be useful for you. So I'm going to hand back to you now, Dermot, for the next part.
Thanks for that, Rachel. Yes, just the last couple of slides, really just looking at NGOs and how do you, practical steps in terms of how you you can respond in the current environment. And this first slide is actually from a report I wrote last year in collaboration with OSF and APCA, looking at the funding requirements and needs for the palliative care sector, NGO sector in Africa, and some of the recommendations coming out from that were around building effective working and relationships and consortia. Developing strong messaging, building internal resources and infrastructure for resource mobilization, and looking at diversifying income. So I just wanted to sort of highlight that, because we're moving on to the next slide, which is about more sort of short-term practical support to NGOs. And one thing that organisations need to do is step up now and advocate very much for ODA and a strong civil society. It's going to be a battle, as I mentioned earlier. Governments are going to start reviewing the ODA budgets, and we're going to see some tough decisions made, and civil society needs to be in that debate. Organisations need to network, that it be they small civil society, grassroots organisations, or national or regional. So it's all about networking and looking for opportunities to collaborate. The donors are looking for that partnership and looking for that multi-sectorial approach and innovation to addressing some of the specific problems associated with COVID-19 and how it impacts on resilience and sustainability, especially within the global health system. Also, as organizations, you need to know what your relative strengths and niche are. Don't be tempted by opportunism to chase the donor, to chase the funding, and waste resources on opportunities that aren't suited for you. And stay informed and agile, and we're certainly going to support you in that, and keep giving you updates on funding opportunities and intel when it comes out. And a specific understanding is needed on the impact of COVID-19 on your work, and how you articulate that to donors. How you build that into your theory of change and your change pathways when you're developing programming, how you adapt existing results frameworks, for example, to build in new indicators on measuring COVID-19 interventions and funding impact for donors, for example, and prepare a case for support around that specific message for your organization. it's going to be a very tough operating environment for NGOs at all levels, at the international global health level, at the regional and national and grassroots level. We're working in a new operating environment, so a socially distanced environment with closed borders and restricted travel. Organizations will have to transform and adapt. And really look at how you're going to COVID-19 adapt and sensitize your organization and your programming as a result. And the upshot is that not all organizations will be able to come through this. There will be a shakeout in the sector. There will be a push to mergers and managed exiting or closures. But there is an opportunity right now, and I think donors are supportive of that, for organizational and strategic change for organizations and funding that support and that change as well. As you can see, there's a whole raft of information there in terms of donor funding opportunities, and tracking the response can and remains tricky, actually, and especially around the uncertainty on whether funding is new or it's rebranded, and what the requirements are, if it's for existing or for new grantees. And all I can say is that it's important to invest some time and resources into analysing those opportunities and make sure that you don't miss these opportunities when they come out. And I emphasize the need for consortia working, for flexibility from being a lead to a sub or an associate in all sort of funding opportunities, and really have that messaging on where you can add value. And lastly, you need to add some surge capacity to your resource mobilization capacity in terms of grant writing, so you can be agile and respond to opportunities when they arrive. So we're going to end now and leave the floor open to questions and answers on all the topics, and there's a whole sort of range of issues that we've covered. We'll be happy to answer some questions, and if we can't answer them, we can certainly signpost you or come back with the information at another time. Thank you.
Thank you very much, Damot. Thank you very much to Rachel for the excellent presentations and for the interactive manner in which you organized this webinar. I would like to take this opportunity to invite people to either write their questions. There is already one in the Q&A by Raymond. I don't know, Damot, can we start with that?
Yeah.
As write their questions.
Sure, just taking a look at it now. So with disability, people with disability funding, I mean, that's certainly a big focus for DFID still. Within the UK aid direct funding stream at the moment, there's opportunities for disability-focused programming, and that could be certainly an area to look at. I'm not sure what kind of organisation. And for the question on business models, well, we're talking about diversifying funding. So one sort of part of the analysis from last year's review of palliative care organisations suggested that NGOs were very reliant on one or two donors and on grant income. And it's about, the business models is about diversifying your income stream. So from grants to include contracts to income generation from private corporate activities. So it's about having a mix of income to become more resilient.
Thank you, Damot. Let's have the question from Pius. Pius had a question.
Is that a written down or a asked question?
Pius raised his hand. And,
okay, thank you. Sorry, I was muted. And I want to thank the presenters for the very eloquent presentations. I am here with Dr. Epie, and he wants to ask a question to you on NCDs.
Hello. Thank you very much for the presentations. As Professor T said, please, I would like to know what funding opportunities are in the wake of COVID-19 for NCDs, considering that people living with NCDs tend to have more severe disease and at greater risk of dying from COVID-19. Thank you.
Yeah. But I can sort of jump in there and just say that there's no specific calls, NCD related calls out at the moment but we can check that for you. But it's certainly going to be a funding priority, I believe, for donors as they look forward and look at what, as we see the global health spend become a bit more competitive. With an aging population, NCDs are going to be obviously a lot more prioritized. So building that into your current programming, if you're focusing in on palliative care, how do you do that? How do you put a COVID sort of sensitive angle into that? You can actually go to your donors locally. We've mentioned that in the presentation. The EU or DFID or USAID at a local level are open to dialogue and discussions, and even more so at the moment. And we're seeing a lot of discretionary funding calls coming out from embassies, for example. So if you've got a small pilot project, then and you've got something worked up and developed, go and chat and present that to a donor. Be proactive.
Thank you. There is another question in the Q&A section by Immaculate.
So there's a lot of uncertainty in terms of effective curbing COVID-19 infections. This won't have a direct bearing on donor commitments to respond to this pandemic. I don't think so. I think there's going to be a big focus on COVID-19 responses and global biosecurity issues going forward. So there's a lot of uncertainty at the moment, but that hasn't stopped donors from stepping up and committing quite big funding for the response. I think only yesterday, the British government, we haven't put this into the presentation, but it hosted a pledging conference for vaccine, Gavi, the vaccine initiative, and raised £6 billion from a range of donors. So, there's a lot of money out there going into very specific areas of global health, mainly in response, mainly in therapeutics and vaccines related to COVID-19.
Yeah, I thought I would just go back and respond to Raymond's question actually about people living with disabilities. And while we don't have information about specific funding that's available, the whole issue of the SDGs and leave no one behind as being a really important part of development focus is one that I think it will be something that a dialogue that we'll be needing to watch over the coming period as different donor countries are kind of focusing in on looking at their national interests rather than actually looking at the kind of overall SDGs, keeping that as a priority. So I think it's a really important advocacy issue. And I suppose that also refers to what Pius was saying about the NCDs as well, that, that these are all important advocacy issues, and there is a window of opportunity for taking forward advocacy with donors just over the next few months.
Thank you very much. There is a question from Pius about whether they will receive the presentation. Yes, we are going to share the audio and video, having the slides as well. So please look out for them. We'll be sending you a link with the today's webinar.
And we'll have the links on one of our slides to all the funding identification portals that are of use for keeping track of what's going on.
And also the briefings that we put together, which will give a lot more detail to the presentations that we've just made.
Okay. Yeah, so let me, there is one question in the question section from Wezi Chioka. Damot and Rachel, can you please look at that question? The one from Wezi Chioka, the last question there at the bottom.
What typical elements of access to ICT in Africa would donors be interested in supporting?
I think all of that. So hardware, training, subscriptions, data. We're seeing a lot of not the traditional donors, but trusts and foundations and other sort of a more social enterprise type financing being made available for ICT and adapting, as I sort of mentioned earlier, to the new normal of socially distanced and virtual working. And I think it's a bit of a learning curve for the NGO sector, very much so. And I do see more funding support, strategic organizational capacity building support coming through from donors, specifically for this issue of skilling up, of leveling up civil society so it can operate in this new sort of environment.
Okay, thank you very much. Damot and Rachel, would you like to make some closing remarks?
Do you want to go first, Rachel? And I'll...
yeah, well, just to say thank you very much for the opportunity to speak to you all. And I hope, you know, do feel free to get in touch if we've got our contact details there. If you need any further assistance or if you would like to follow up on any of the points that we've raised during the presentation, feel free to get in touch with us.
Okay.
And thank you for inviting us here.
Welcome.
And my final message would be to be positive. It's a tough environment, but there are opportunities out there, and collaborate and work together. And really focusing on what your niche is, develop the messaging and the case for support around that, and engage with your donors.
Thank you very much, Damot, and Rachel for this webinar. We really want to thank you so much for the time you've put in to organize and then assemble all this together. We're very appreciative. On behalf of my team at APCA, we want to thank you very much. I also want to take this opportunity to thank the team at APCA that has worked with Damot and Rachel to put this together. Frank, our IT person, Wezrai, and Patricia. I also want to thank our donors who keep us moving, the teams from OSF, from True Colors Trust, from Global Partners in Care, and all our other donors for keeping us going and keeping the work of palliative care going on the African continent. With those few remarks, let me close by thanking all of you who have attended. I see we have people from different parts of the world. We have people from India, we have UK, US, Canada, and then the rest of Africa. We want to thank you so much for being with us. And with those remarks, let me wish you a very nice time. And I hope we all survive the COVID-19 epidemic and we'll meet again. Thank you very much.
Okay.
Thank you, Emmanuel.
Thanks very much.